I'm going to be talking about incentivized medicine and the misdiagnosis of pediatric bipolar disorder in America from children ages 2 to 18. Just 1 decade ago, pediatric bipolar disorder was so rare, most psychiatrists would never see a single case in their entire career. Today, it has become the most frequent diagnosis of severe mental disorders in children. Some reasons for this include media coverage, the pharmaceutical industry's influence on clinicians, and the inadequate diagnostic tools that the clinicians use today. This extreme rise in diagnosis has alarmed many professionals in health-related and public service fields because the most common treatment is dangerous medication with severe side effects. Not all these medications have been adequately tested for use in children and have caused serious harm. In one case, a 2-year-old was diagnosed with pediatric bipolar disorder and put on many medications. One medication is primarily used to treat high blood pressure and was given to the 2-year-old to help sedate her. She ended up dying. Media coverage is partially to blame for the rise in pediatric bipolar disorder. It has been discussed on shows such as Oprah Winfrey, 2020, 60 Minutes, and many others. This coverage contributes to the likelihood that clinicians will make a mistake in diagnosis. They can also receive pressure from parents to diagnose pediatric bipolar disorder rather than conduct disorder, which has a stigma for being the result of bad parenting. Conduct disorder has more to do with the child's environment. In contrast, pediatric bipolar disorder is a physiological condition which affects mental health and thus can be covered through insurance. Conduct disorder usually would not be covered. Pharmaceutical companies also pressure clinicians to make certain diagnoses for which they can prescribe their medications. They achieve this by offering certain incentives ranging from kickbacks for every prescription they write, paying them as consultants if they agree to use certain medications with their patients, and payment through less direct means such as a free, luxurious vacations. Lastly, we need to consider clinicians' ability to accurately diagnose pediatric bipolar disorder. In the Diagnostic and Statistical Manual of Mental Disorders, the 4th edition, it does not have clear definitions in how to diagnose a child with pediatric bipolar disorder. Due to pediatric bipolar disorder becoming a trendy scapegoat for behavioral problems in children, it has become frequently misdiagnosed. Many diagnoses have been reverted after reassessment, but not before damage was done. The side effects of the medication used often include obesity, organ failure, and even death. Yet still these medications are pushed due to incentivized medicine. Pharmaceutical companies have the most to gain from the prevalence of pediatric bipolar disorder, which is why they push clinicians to prescribe their medications by giving them free samples, paying them as a consultant, or paying them through other means such as free vacations. This graph shows the amount that pharmaceutical companies spent on promoting their products in 2012 alone. Action must be taken to combat this problem, and there are several ways in which it can be done most effectively. Perhaps most importantly, the diagnostic criteria for pediatric bipolar disorder must be revised for clarity. Thankfully, updating the section on pediatric bipolar disorder is one of the primary changes for the DSM-5 set to come out later this year. Raising awareness in parents can also have a big impact, as many parents actually seek out a pediatric bipolar disorder diagnosis. Lastly, checks and balances are needed. The recently passed Sunshine Act has been a necessary first step requiring pharmaceutical companies to report all financial exchanges to clinicians and teaching hospitals. It should not stop there, however. Clinicians should also be held accountable and be required to report prescriptions of dangerous medications to minors. If you have any further questions on this topic, please feel free to contact me at my email below.